Crippling period pain, heavy bleeding, painful sex, these might not be normal. Let's talk about endometriosis. Endometriosis is a complex condition where tissue similar to the lining of the uterus, known as the endometrium, starts to grow inside the uterus, often on the ovaries, fallopian tubes, and the pelvic lining. This tissue behaves like the uterine lining, thickening, breaking down, and bleeding during each menstrual cycle. But unlike the lining inside the uterus, there's no way for this blood to exit the body. Now, this causes inflammation, scar tissue, and adhesion formation, leading to pain, fertility challenges, and potentially long-term damage to surrounding organs. At the molecular level, endometriosis involves the activation of immune cells that trigger inflammation and oxidative stress, which can damage nearby tissues and lead to the formation of fibrosis or scar tissue. Over time, this inflammation can disrupt normal function in the reproductive organs and beyond, sometimes affecting the bladder, intestines, or even causing pain during bowel movements. Symptoms of endometriosis can vary widely, but they often include intense cramps, chronic pelvic pain, painful intercourse, digestive issues like bloating, constipation, and diarrhea, as well as chronic fatigue. Many women also experience infertility due to the impact of endometriosis on the ovaries and fallopian tubes. Some may go years without a proper diagnosis, as these symptoms are often mistaken for other conditions. Diagnosis often begins with a detailed conversation with your healthcare provider, where they will assess your symptoms and medical history. Imaging tests, such as ultrasound or MRI, may be used to look for cysts or other signs of endometriosis. However, the gold standard for diagnosis is laparoscopy, a minor surgical procedure that allows doctors to visualize the affected areas inside the pelvic cavity and, in some cases, remove tissue for biopsy. Treatment for endometriosis is highly individualized, depending on the severity of symptoms, the extent of tissue growth, and whether a woman wants to preserve fertility. Medications, such as non-steroidal anti-inflammatory drugs, NSAIDs, can help relieve pain. Hormonal therapies, including birth control pills, IUDs, or GnRH agonists, work by reducing the hormonal fluctuations that drive the growth of endometrial tissue. For more severe cases, surgery may be required. The goal is to remove the endometrial-like tissue and adhesions while preserving as much of the reproductive organs as possible. In some instances, if fertility preservation is a concern, in vitro fertilization, IVF, may be discussed as an option. Moreover, lifestyle changes, such as regular exercise, a balanced diet rich in anti-inflammatory foods, and stress management techniques like yoga or mindfulness, can be essential in managing the condition. Studies suggest that reducing stress levels and inflammation can help alleviate symptoms over time. Endometriosis isn't just a physical condition, it also has a significant emotional impact. The chronic nature of the disease, its effect on fertility, and the unpredictability of symptoms can lead to feelings of frustration, anxiety, and even depression. Support groups, therapy, and mental health resources can be vital in helping women cope with these emotional challenges. Research shows that psychological interventions like cognitive behavioral therapy, CBT, can help patients manage the mental and emotional toll that endometriosis can bring. While endometriosis can be overwhelming, there is hope. Advances in research are improving our understanding of the condition, and more effective treatments are being developed. With proper care, self-management, and a strong support system, you can regain control of your life and your well-being. Know the signs, spread awareness, and don't wait to get help. Together, we can break the silence around endometriosis. Please like, subscribe, and share with others who may benefit from this information. Thanks for watching, and remember, you're not alone in this journey. I'll see you in the next video.